is, inshallah, one nation will be sponsored here.
Look there. This building.
Yeah, and you can actually see it, all the surrounding area has been destroyed completely.
There is, look there.
Airstrike, yeah.
What is that there?
Just 2 days ago, you can see at the bottom of the road down there, that was all destroyed. Just 2 days ago, by regime airstrike down there.
Look very properly, man. You know, you can see it properly from here. Look like from here, man.
Okay, that's right next to the hospital. That's just there.
This row.
Yeah,
Here.
yeah.
Here.
Mr. Doctor
Party
mentioned yesterday,
2 days ago.
They gave me an airstrike here.
First, we welcome of you, and then we thank the One Nation for the helping of my hospital.
Look at the situation here. The regime hit this, yeah? And just in the room, which is down here, subhanAllah, we're gonna show you this, yeah? Look, this is the, cut this in please. This is where the regime hit the hospital, and if you were to look inside the room which is next to the hospital, show them what's inside. Show what's inside this room down here. There's the premature babies in this room. This is how close it is. Come here, get here. This is a premature baby in this room down here, and if you were to look outside the room, just outside here, it's the regime airstrike. Yeah, it hits the hospital down here. Look how close it is. Check the streets out as well. This is the streets outside the hospital. Everything is destroyed here. Assalamu alaikum. Everything is destroyed here. Wallahi, we really need to try, continue helping raise donations to support this hospital, because not a lot of people are helping this hospital. Inshallah, may Allah make use of us to
Yes,
help
you
them.
can see another child.
Another child?
They come now.
Just right now? These 2 babies have just come to the hospital just right now. This is the baby's name is baby Ahmad.
Ahmad Iklido has bronchitis.
How old is the baby?
About 1.5 months.
1.5 months. Subhanallah. May Allah grant Ahmad Shifa. Ameen.
Inshallah. طب تشوف دكتور احمد the surgery of my hospital.
Okay.
From the button of mother there has injury in his button, his abdomen. Yes. They do colostomy.
We just had man in Norman Hospital. Alhamdulillah, we were recommended by one of the brothers in UK, Abdul Wahid, Don Convoy. Alhamdulillah, we're here. We've just given some aid to Dr.
Marrat Al Numan.
Alhamdulillah, the doctor will give us a small talk inside hospital, show us a little bit, and inshallah will give us some information what is required, and inshallah give us information that we can have them, inshallah.
Just a quick insight for those of you who may have not seen the videos before this. We've come into this area and we can already see that the situation in this area is really bad. It's really run down, and everything around the hospital is bombed, and the whole area is bombed. It's like ghost town. I remember when we went to Aleppo, it's very similar to Aleppo. The whole place is run down, all the houses, buildings, everything is destroyed by regime. Yeah?
Yes. Awesome.
Okay.
The day before yesterday, I have seen a patient above 16 years old. He has renal failure and he has high blood pressure. After I have seen him and give him the drugs, he told me, I have to come back to you after 1 week. I said, yes, come to me to see you again. But after 5 minutes, he comes marathons after the crowds of plane comes to about 200 meters from my hospital. And 5 other men have been died. Despite to the injuries to many patients.
When was this? How long ago? Yesterday.
After yesterday.
Before
yesterday.
This isn't the old story. This was just 2 days ago.
Well, this is common. It happens very regular.
Every day coming down here.
2 years ago, before yesterday, about 12 p.m., the plane, about 2 cruisers to the plane and destroyed buildings and have 5 patients died and many injuries.
Is there a lot of people helping in this hospital?
Have many patients. What you mean?
A lot of people helping financially in this hospital, or no, it's a bad situation?
So there's a lot of people help you with this hospital. Does any charity give you money? Does it
Only some neighbors, friends. We have some assistance only. All our works in this hospital free.
Subhanallah.
You treat everybody for free?
Every operation, ecography, cardiogram, analysis, everything free.
Alhamdulillah. As you could hear, the brother is mentioning that everything in this hospital is free. They have very, very little support. Alhamdulillah, with your donations, we help this hospital as well. And we want to help this hospital more. So inshallah, please keep your donations coming. And Brother Majid will say a few words, inshallah.
Yes, it's important. We're on the ground. We try to find the hospitals which are further inside Syria who need urgent help. So we're trying to find all these different hospitals and places which need help. So now when we go back home, we're going to do a big appeal to help raise donations. So we can come back, even if we don't come, we can just transfer the money to continue helping the patients down here, inshallah, because the situation here is very dire and they need urgent help because people are dying every single day. And as the doctor said, that they're treating people down here for free of charge because there are a lot of poor people here.
Many.
A lot of poor
And
people.
also the village about Al-Marra come to here.
Everybody in the surrounding areas as well.
One more question. Is this the only hospital or do you have many more hospitals like this?
There is 2 other hospitals, but this hospital is the only hospital who gives born room to born to operation Kaysariyat.
So it takes more surgeries and more...
Surgery and born.
More.
ولاد قيصريات.
What does that mean? What the doctor said?
عمليات قيصرية ولادات هو المشفى الوحيد للقدمة.
Assalamu alaikum warahmatullahi wabarakatuh. Majid, I'm a volunteer for One Nation. I'm in Addana in Syria. Right now it's February 2015. I'm with Dr. Yasser, who is the main doctor in Addana Hospital. How are you, Akhi?
Alhamdulillah, fine.
Alhamdulillah. We wanted to ask you a few questions about the hospital which we are sponsoring. This is sponsored by
Yes.
One Nation. We wanted to ask you, what is the situation like in the hospital? How long has the hospital been open? How long has it been open for?
The hospital was opened before the revolution, but he is the lone hospital who take or receive patients after regime attacks.
How many patients do you receive a month, or how many patients do you receive daily?
A lot of patients, akhi, wallahi, there is a lot of camps here near Addana, in Atma and Akrabat, in Kafar Daryan. A lot of camps. We receive a lot of patients every day, maybe more than 100 patients.
More than
daily.
100 patients every single day.
Yeah.
Sometimes more than that.
Yeah.
What sort of patients mainly come in the hospital? Is it men, women, children?
Yes, all of patients, we can receive all of patients. We have a department for women, for pediatrics, for surgery, for internal medicine. We have
So you have an emergency operation?
yeah, of course. For the patient who exposed to attack from regime, we take them
So you
to the
treat them
emergency room.
straight away?
Yeah.
Okay, how many staff are there inside the hospital?
Our staff, all the staff, there is maybe we have 40 nurses and 10 doctors.
You have a lot of children coming in from the regime attacks?
Of course, a lot of injuries from children and women.
What kind of injuries?
Maybe fractures, maybe wound in brain, in abdomen, in severe injuries. Maybe he need amputation for his leg here, his arm. Yeah.
I seen last time. I seen pictures on Facebook. Your hospital was attacked as well by the regime before, right?
Yeah. Maybe our hospital is the first target for the regime, because we deal these needed people, so they attack our hospital more than 4 times.
SubhanAllah, so they attack you to try to get you scared,
Yeah.
so that you
Yeah,
shut down as well.
Yeah, subhanallah.
But you're still operating,
Alhamdulillah, we will continue, inshallah.
Inshallah. What's the main thing that you need help with inside the hospital?
Yes, sir. We need a lot of things. We need equipments and machines, modern one, to make difference, to give the patient more help, inshallah.
How many are there a lot of people helping this hospital?
No, not a lot.
So you don't have much help.
We don't have a support. Just some organization like One Nation, Jazakamullahu khair, give us some support,
Inshallah.
and we need
much more support.
much support from you. As a Muslim, we need you to help
Don't
us.
get funding to help this hospital. What will happen to the hospital?
Without your support, without your help, we will stop maybe.
The hospital will shut down?
Shut down the hospital.
How many people will it affect in this area?
This is a crowded area. Maybe more than 500,000 people live here in this area.
SubhanAllah.
Yeah,
So it will affect that many people.
of course.
SubhanAllah. So as you can see, you heard it from the doctor yourself firsthand, what the situation is at the hospital. Alhamdulillah, we've been blessed with an opportunity to help this hospital and all of these people in this area. We want to continue supporting them, inshallah. So we'll need your support and all of your lot's help to help keep this hospital running, inshallah. We'll carry on posting updates so you can see as well what the situation is like in this hospital. So please, if you can help, donate at the link below. And if you can't donate at the link below, if you're not in a situation where you can financially help, keep us in your dua, and please share this link as well, so many other people can inshallah contribute towards keeping this hospital open. Jazakallah.